All right, everybody. I see our participant numbers are like literally going up by the minute, but I'm going to go ahead and start anyway. So thank you very much for joining us today. On behalf of the University of California Center for Climate Health and Equity, the Eco Health Center, the University of California Climate Change and Mental Health Council, we welcome you today to our second of our six-part webinar series on urban wildfires and protecting health and well-being, which is co-hosted by UCLA Center for Healthy Climate Solutions, the Fielding School of Public Health at UCLA, Sustainable LA Grand Challenges, the UCSF Alumni Association, and the communications teams both at UCSF and at the UC Office of the President. I really want to reiterate our thanks to our amazing team of faculty and staff who put this webinar together in a very short period of time, including my CCHE co-director, Sherry Weiser, Alyssa Eppel and Jyothi Mishra, who run the University of California Climate Change and Mental Health Council, David Eisenman, Mike Jarrett, Jennifer Shear, Claire Brindis, Tarek Ben Marnia, Neetha Thakur, Robin Cooper, Philippe Golden, Sigal Maya, Anne-Marie Charlesworth, and Annie Rosenthal, as well as the UCSF and the UC Office of the President communications teams who helped make really all of this happen. I also want to extend a special thank you to Dr. Dick Jackson, who has been a key thought partner throughout planning and helped really oversee the design of this particular session that you're going to get to hear about today. And I will be introducing Dr. Jackson in greater detail when he gives his talk during this session. As we open for this particular talk, the impacts of the LA wildfires on livelihood and health have and will continue to be felt, with over 57,000 acres burned and about 16,000 plus structures destroyed. Many have lost lives and been injured. For those who have lost their homes and continue to seek shelter and support, and for those who are returning to their homes and spaces, the health impacts are yet to be determined. And our hope is that this series will help prepare the state, Los Angeles, and the University of California communities to protect themselves. In today's session, we're going to hear from experts in California and throughout the U.S. talk about the impacts of wildfires as they are especially relevant to children and how to keep them both safe during and after wildfires. These webinars are recorded and the links will be sent out to all of those who signed up. And we're also working on translations in Spanish. You can find the resources on our website, which we have included in the chat, and we hope that our center will serve as a resource to our communities throughout California during this public health crisis. Please get the word out to those who you think may benefit from this information. As a heads up, our session next week is at the same time and will address how to help people who are impacted get access to psychological first aid tips and community support. With that, I'm going to now turn it over to our panel of distinguished speakers, starting first with Dr. Amy Brown. Dr. Brown is board certified in pediatric pulmonology and general pediatrics. She is assistant professor of pediatrics at New York Medical College School of Medicine and an associate professor of public health at the School of Health Sciences and Practice. She is currently employed by Boston Children's Health Physicians and is an attending physician in pediatric pulmonology at Maria Ferrari Children's Hospital. Besides clinical work, Dr. Brown is engaged in education, research, public health, and advocacy. She is the assistant director for the Children's Environmental Health Center of the Hudson Valley, a center of excellence awarded by New York State, and a particular center of the New York State Department of Health public funded NYS Children's Environmental Health Centers. With that, thank you, Dr. Brown, and I'm going to turn it over to you.
Great, thank you so much. I'm going to share screen. Thank you for that introduction. And again, my name is Amy Brown. I'm a pediatric pulmonologist. I practice in New York State. And I just wanted to take a moment to express to the audience how grateful I am to be with you all today. So many of us on the East Coast have felt really helpless to all that's happening in the state of California. I know in my own personal life, I've supported dear friends in California caring for children with respiratory disease or who are on the front lines of pediatric care in Los Angeles. And so I'm just really grateful that in my professional life, I'm able to impart a small tidbit of my pulmonology expertise and learn with you all today. Okay, so I'm gonna present a lot of information, and it may seem complex and dense at times. So I just wanted to start out with my key messages as you take in everything we're about to talk about. The first thing I want you to understand and appreciate is that the respiratory system is an important first line dynamic filter between the environment and the human body. And we'll go through this in about 90 seconds, but it's a really complex topic, but an important point for us to understand. I'll then talk about why this is relevant for children. And there's a common mantra in children's environmental health where we say that children are not just little adults. And I'll explain to you some of the reasons why this is the case. And then finally, where I'll leave you and what some of my panelists will talk about are interventions to improve children's health that are family-centric and rooted in healthy homes and healthy schools. So as I mentioned, the first point that I want to make is that the respiratory system is a dynamic whole body filter. And so when I mention this, what I'm really talking about is a variety of different particles and toxins, chemicals that are being filtered. I'm going to focus a lot on particulate matter. The abbreviation is PM. And then what you can see in many of these subscripts here is it defines the diameter of that particle. So the smaller the number, the smaller the particle. And a lot of what we're focusing on is for particulate matter, or PM, 2.5 microns, that's a diameter, and smaller. And just to give you a depiction, this is a graphic from the EPA. If you can picture a piece of fine beach sand, that's about 90 microns compared to 2.5 microns, which is infinitely small. And these are the particles that we're worried about depositing within the body. And so I'll take you through on this second picture what that looks like. So we know that particulate matter, for example, larger particles, so micron diameter of 10 or greater, will be filtered out by the nose, by various parts of the upper airway, and largely won't make it into the chest cavity and into the lungs. But what we see is that as particles get smaller and smaller, so particulate matter 2.5 and less, it can penetrate deeper into the respiratory tree. It can go into those deep parts of the lungs where gas exchange takes place, so where oxygen is entering into the bloodstream, and they themselves can enter into the bloodstream. And our smallest particles can do this freely, and then what happens is it ends up in systemic circulation. And so this filter is really efficient. It's working full time, all the time, to filter out all of our environmental toxins that are present in everyday life. And you can imagine that with wildfire smoke and with complex particles that this is on overdrive. Now, I mentioned that this is a dynamic filter. And what that means is that the lungs have a variety of innate and adaptive defenses, so they can coordinate responses that involve inflammation, immune responses, and oxidative stress. And so what we have to think about is not only what's happening in the lungs, but then these secondary responses that are taking place and how that affects children's health as well. So I mentioned that children are not just little adults, and I'm going to give some examples in various categories. So the first is thinking about physiology. Children are, as we know, smaller, and if we can picture the size of their chest wall, that is smaller as well. Many of us in this room are sitting here breathing at about 14 to 16 breaths per minute with an adult-sized chest wall. But again, as I mentioned, infants and children have smaller chest walls. So in order to take in enough oxygen and breathe out enough carbon dioxide, they need to breathe faster. So children have what we call higher minute ventilation per kilogram of body weight, which simply means that they breathe in more relative to their body size. We also talked about lung filtration and deposition briefly, but we know that anatomical differences in children, especially with development of the airways, can lead to different deposition of particles lower in the respiratory tree. Children also exhibit immature toxicokinetics, and a lot of this just has to do with development over time. And so when I say toxicokinetics, I'm really talking about various features of how we absorb things from the environment, how they're distributed, what tissues they go into, how they're metabolized, and then how they're excreted and if they can be excreted from the body. And again, this is very different in developing children than it is in adults. Children also are developmentally susceptible to the environment. And this is because there are critical windows where exposure can change the trajectory and growth of, and development. And so one of the examples, and we'll talk about this in just a few moments, is thinking about exposures that exist as prenatal or perinatal insults to a pregnant woman, and how they can have lifelong disruptions to organ system development and a variety of downstream health effects. And then finally, children exhibit unique behaviors. And we know this to be true when we look at what children are doing. They can exhibit more vigorous activity in any given time. If we think about school structures and just the structure of children's everyday, they spend more time outdoors. And then if we think about our youngest children, they have additional exposures, use of their hands, hand-mouth behavior. Younger children spend more time closer to the ground, which can have implications for particulates as well. So this is just a snapshot of why it's important that we understand not only the health effects of wildfire smoke, but we really extrapolate this to understanding and studying this in children as well, so we can form a strong evidence base. I just wanted to take a few minutes to think about how we approach the inhaled dose of wildfire air pollutants. And as many of you think about public health recommendations and where they come from, thinking about really these categories that help us describe what is the inhaled dose and how do we respond and make both individual and societal recommendations. So the first thing in the equation is thinking about the concentration. Now, air pollution from wildfire smoke is very complex, and it's a mixture of a variety of different toxins and chemicals. So it's very different to pinpoint the exact concentration of any given toxin. And then atmospheric conditions can also play a role. But this is why monitoring air quality is so exceptionally important, and how they can be a useful tool in understanding our behaviors and how we respond during and after wildfires. Ventilation rate plays a role in the inhaled dose to an individual. As I mentioned, this is going to be higher the younger the child. And then if you think about those of us who are sitting here now, again, breathing at a rate of maybe 14 breaths per minute, to those of us who may be running and breathing at a rate of, we'll call it 28 breaths per minute, that will increase your ventilation rate. And so recommendations for avoiding vigorous activity come into play here. And then finally, the time that you spend in an exposure area. And this is again where we think about reduction of long outdoor activities and moving activities indoors. But it's really this equation that helps form the basis of how we make recommendations with regards to respiratory health and exposure to wildfire smoke. So what are some of the pediatric health outcomes related specifically to particulate matter and wildfire smoke? The most robust evidence is around pediatric respiratory outcomes. And there's a paucity of evidence. It's definitely growing. But when we look at the literature, we really see over and over again, especially literature that looks at health utilization data and visits, that pediatric asthma visits are greatly increased during times of wildfire smoke. Now, asthma is a complex disease, but it is characterized by inflammation, which particulates can trigger, as well as reactive airways. And so as you think about the lungs as a filtration system, many of the effects from wildfires in children with asthma may actually happen before systemic circulation and local effects on the airways. We then want to know, well, who are these children who are going to be affected and have worsening asthma symptoms? And there's a signal in the literature with regards to children with a higher BMI, and then our youngest of children, especially those with asthma, who will have worsening symptoms. And then the literature also reports other respiratory symptoms that are present, especially upper respiratory symptoms, itchy eyes, sore throat, sneezing, and lower respiratory symptoms such as cough, wheeze, or pneumonia. And finally, it's really important to think about, well, where are these evidence gaps, especially as a pediatric pulmonologist? So I know I'm really focusing on the lungs now, but we are learning a lot about children with asthma, but there are a variety of lung diseases we take care of. And so being able to have guidance about patients with cystic fibrosis, with alpha-1 antitrypsin deficiency, patients who have chronic respiratory insufficiency and may be ventilator dependent. These are all really important areas for us to discuss as well, especially because we know that inhalation exposure is a primary source for wildfire smoke. There is really robust evidence about pregnant women and prenatal exposure to wildfire smoke. A lot of it comes out of the state of California. And what's known as that wildfire particulate matter, PM 2.5 exposure during pregnancy can increase the risk of preterm birth. This is significant for many reasons. We know that kids or children who are born premature can have a whole list of adverse health outcomes just related to premature birth. And this also puts pressure and strain on the system for caring for children who are born premature. And so there are a lot of different factors here. We're just starting to understand this. But as we think about children, I mentioned that it's a family-centric approach. We really need to include pregnant women in our thought process as well. And so as I review the literature and think about how we can best understand pediatric health outcomes, there's a lot written on particulate matter and how that affects children's health. A lot of this is on ambient particulate matter, so what's present at any given time, regardless of wildfire status. And so what we really need to do as with regards to science and where things are moving is really understanding wildfire-specific particulate matter and exposures. So with that being said, I am delighted to be a part of this panel to talk about some key pediatric interventions. I'm going to let my colleague, Dr. Patel, go over that in her talk shortly. I would be remiss as a pediatric pulmonologist if I didn't mention that prevention is a key, especially with regards to asthma care. So one of the things, I'm sure many of you are listening to this talk with a great deal of worry, but there are things we can do. Especially with regards to having a child or if yourself has asthma, really important to have regularly scheduled preventative visits, good asthma control, access to quick relief medicines. We can, during the Q&A, discuss any questions about respirator. Those are your N95 masks and interventions that homes and schools can take to keep children safe. So with that being said, I would just like to thank you all for this wonderful opportunity. And I'm just really grateful to work with you as an advocate for children's health. Thank you.
Thank you so much, Amy. And with that, I'm going to turn it over to Dr. Lisa Patel, who is an associate professor of pediatrics at Stanford University. She is currently the executive director for the Medical Society Consortium on Climate and Health. And she maintains a clinical practice as a pediatric hospitalist, caring for newborns, premature infants, and children requiring hospitalization. She's also an incredible advocate, and her work has appeared in the New England Journal of Medicine, the New York Times, LA Times, Bloomberg News, and many other outlets. And so with that, I'm going to turn it over to Dr. Patel.
Thank you. And thank you, Dr. Brown, for that incredible presentation. And it sets me up nicely to go into some specifics around things that we can do to make sure that children and teenagers are safe during this time of recovery. I do want to point out that the County of Los Angeles and the state of California have put out a number of really good resources to point to. And I'm just going to be highlighting a few of those in this presentation so folks have something to return to after you're done with this presentation. In terms of returning home, there are three categories of homes we're seeing right now. Ones, unfortunately, that have been entirely destroyed in the fire. And for that, I would turn to the resource from the government, California, ca.gov/LA fires, that has resources on how to navigate financial resources to rebuild homes that have been partially destroyed, and then homes where there is ash. For folks that are returning to homes with ash, I think one of the important things to understand is that children and teenagers should not be participating in cleanup of that ash. For all the reasons that Dr. Brown mentioned, children are more sensitive to these types of toxins. Multiple organ systems are in a stage of rapid growth, particularly in those first few years of life. And exposing them to these types of toxins early just increases their exposure window over their lifetime, increasing their risk later in life for adverse health outcomes down the road. And then there are some recommendations for how adults can safely clean up ash within the house. The most important thing is not to be using like a vacuum cleaner that can throw that dust up and potentially be inhaled, using some mist to help that dust settle, and then wiping it with damp cloths, for example, is a good way to get it out of the home. If you are going to use a vacuum, just making sure that you're using a HEPA filter. And then any toys or objects that a child might be playing with, just making sure that it's thoroughly cleaned before the child plays with it. The reasons why we're concerned, every wildfire is very different. What's concerning about the wildfires that have happened in places like Lahaina and in Los Angeles is that this has been at the urban interface. And so it hasn't just been biomass or trees that have been burning. It's all of the things in our homes and all the things that exist in an urban environment that are potentially toxic. So these are things like pesticides and batteries, plastics, electronics, furniture, petroleum products. And so what we worry about is that this toxic ash that's there has other hazards. So things like heavy metals, dioxins, polycyclic aromatic hydrocarbons, and then buildings that are older than 1980 might have asbestos in it, which we also know carries significant health harms and risk. There are things that each of us can do to stay safe. And so we've talked a little bit about ash, and now I want to talk a little bit more about wildfire smoke. And Dr. Brown talked us through why that particulate matter pollution is concerning. In addition to PM 2.5, again, wildfire smoke can carry additional toxins in the air because it happens in these urban environments with other chemicals in the air that are potentially hazardous to human health. I really like these resources from our Western Pediatric Environmental Health Specialty Unit. There are some simple graphics here on things that you can do to stay safe. So one of the most important principles when the air quality is poor outside is to stay indoors and then create a safe indoor space for yourself. So investing in a portable air filter, if you don't have something called an HVAC system, so an internal duct or filtration device within your home. If you do have an HVAC system within your home, making sure that it's a MERV 13 filter or higher. HEPA filters are the best, but what we often run into with both residential homes and with schools at times, there's a much bigger energy expenditure with those HEPA filters, and then there's a lot of push-pull, so those tend to rip a little bit more. So it requires good vigilance if you are using HEPA filters. MERV 13 filters offer a decent amount of protection as well and tend to rip less often. So MERV 13 or higher filters, you can add an additional layer of protection by doing a portable air filtration device as well. I work with a lot of families that are food insecure. It's unfortunate that clean air is the commodity, but if a portable air filter is out of a family's financial reach, there are also resources through the EPA on how to build a DIY. And so that just involves a box fan, a HEPA filter that you can nail. You can use bungee cords or duct tape to put those together. And some informal studies show that you can get about a 50 to 60% reduction by using these types of DIY box filters within your home. Masking, we recommend no masking for children under the age of 2 because that's a suffocation risk. If they're in the toddler age 2 and up, just making sure that there's an adult present and the child has the ability to remove the mask. A child in that age group can use a KN95, but it's really all about fit and it's about compliance. And so if your child's constantly taking off, if the fit is not good, it's better to just try to keep the child indoors than enter a lot of battles about masking if it's a poor air quality day. And even if you have a mask, you should be limiting your time outdoors during a poor air quality day anyway. For children that are 7 and older, a small adult N95 can possibly fit their face. And there's some recommendations here to know whether you have a good fit or not. So signs of a poor fit are feeling the movement of air on your face, fogging of your glasses, or lack of pressure being built up on the inside of a respirator on exhalation. But like I said, the best protection, especially for younger children, is to keep them indoors. In terms of preparing schools for the reopening, I've gotten a lot of questions about, is it safe? There's going to be ash, indoor air quality. And again, the County of Los Angeles has some good resources for schools as they're getting ready for reopening or have started to reopen. The ash should be cleaned up prior to children returning. Professional help is ideal, but there's very good guidance on how people can achieve that cleaning themselves as well. Ventilation ducts should be inspected and cleaned of ash. The outdoor areas should be wiped down as well because there was so much ash that built up. And in the addition to the fierce winds that we saw, the ash has been blown into many places. And then given how much ash is present, some ongoing vigilance is needed as well to just make sure that ash isn't ending up in the garden areas or on the playgrounds where children, because they do exhibit that hand-to-mouth behavior, might be exposed to it. Schools should have HVAC systems installed with MERV 13 or higher filters. Schools without HVAC systems should be using portable air filters. And then in schools that already have HVAC systems, as I mentioned, that portable air filter can be an added layer of protection. The last thing that I just want to mention, and there has been significant valid anxiety about sending kids back to school when there is that risk of toxicity around. But one of the things that we've learned in working with other districts that have experienced wildfires is that the fastest way for children to heal is to be back in community with other kids who are going through the same thing. These disruptions and keeping kids out of school, especially if the school is taking reasonable steps to keep the environment clean. Many parts of Los Angeles will be struggling with the toxic ash for a while to come. In the meanwhile, one of the most important ways for children to heal and move forward is to be back in a sense of normalcy and back with their peers. And so although the risk of exposure to toxins will not be zero, there are the steps that we talked about can help minimize the risk of exposure to those toxins. And then from here, I think I'm handing it over to the next presenter who's going to be talking about how we talk to our kids about these disasters and just recognizing the importance for mental health services for what children and families have gone through.
Thank you so much, Dr. Patel. I think that's an important transition and something that we have to actively be thinking about. And so with that, we're actually going to, our next two speakers recorded a short video for the group because they couldn't be here in person. The video we're going to watch is by Dr. Chandra Ghosh Ipin. She is Associate Director and Dissemination Director of the Child Trauma Research Program at the University of California, San Francisco, and the Early Trauma Treatment Network. She has worked on multiple studies on the effectiveness of psychosocial intervention programs with Spanish-speaking children and parents. As a first-generation East Indian Japanese American, she is committed to examining how culture and context affect perception and mental health systems. And with that, Anne-Marie, yeah.
Hi, I'm Chandra. I wanted to share that I spent 6 years in Los Angeles during graduate school, and my heart is with all of you. So let's think together about how we can support children and families after wildfires. I thought I would begin by sharing a few resources that I helped to develop with colleagues from the National Child Traumatic Stress Network and Alicia Lieberman. The first is the Trinket and Sam Disaster Series, which has a version for families who've experienced serious fires. We embed mental health principles into stories and hope that the stories support families in having conversations about what they went through, how they're feeling, and how they can feel safe again. This one-page handout uses the acronym SAFETY and lists key ways that grown-ups can help children. And then the appendices to psychological first aid offer guidance for understanding common challenges, for understanding difficult behaviors that we might see after a disaster. What are common reactions, such as not sleeping, perhaps having lots of difficult behaviors? How can we understand that with young children in particular, behavior is communication, that they often don't have the words to talk about their experiences. And so it comes out in ways that are less than ideal. But if we understand them, we can figure out things to do. And the table lists things we can do and things that we can say to help them. Now, as we're thinking about how to help children, I thought I would share the child-parent psychotherapy guiding visual, which is what we call our triangle of explanations. And so when we're thinking about a behavior or a challenge, we put that on the right-hand side of the triangle. And then we try to connect it to what has the child or person been through? What's their experience? And when we do that, we find that we typically make a much better plan. And as we do this, we hold all of the good that the family is doing. Now, we're here today to really acknowledge that unfortunately too many children and families have been affected by the danger of the fires. And the reason I'm using the word danger is because when we experience overwhelming danger, we have to acknowledge that our bodies are designed to remember that danger, and that even children, even pets remember that danger, and we wish they didn't, but they often do. Now, here are a few things that I've found helpful in my work. One is to understand that danger can remind the body of past danger. And so we may have a child where they had an experience with the fire. It may not seem as serious as what others have gone through. But if they had an earlier experience, it could be something medical, it could be an accident. Sometimes you may see a stronger reaction in the child because if you think about the layers of experience, this recent experience is waking up old fears and old dangers. Now, another thing that may be helpful to think about is the idea that when we're in a moment of danger, all the things around us and also even our own body-based reactions can become associated with that danger. They become possible reminders or triggers so that later, days later, months later, sometimes even years later, when you're in the presence of something that reminds you of that danger, you may see again a behavioral response, a feeling response, because that's what our bodies are naturally designed to do. Now, when we think about possible reminders, a common reminder, and this is from the Trinka and Sam's story, would be sirens, right? Because you often hear sirens when there's a fire. And that when that happens, if you go back to that triangle, you may see a very strong reaction. Another very common reminder is the smell of smoke. And if you see here, even the barbecue smell could remind a child of the fires. 4th of July, fireworks, that can also remind people of the fires. Now, I put this picture here because clearly smoke and sirens, that makes sense. But sometimes if you have a child who part of their experience was that they were at school, that they were in danger and that they were separated from their family, they may come to associate school or things that they did with danger. So things that seem not exactly connected to the fire can also be reminders. And I did mention earlier that, as we think about being in a moment of danger, our bodies can have kind of lots of feelings inside them. And for children, sometimes that feeling state, that feeling of fear, that feeling of anger, when they have it later on, it can remind them of the day when they had it, and it was really big. And so just think about the siren outside, but it's in your body, so people don't always recognize it. And another thing that I'm thinking might be helpful to share is that there aren't just reminders of danger, but there can also be reminders of loss. And this comes from the work of Robert Pinus and Chris Lane. And so as an example, if you would imagine that after the fires, a child is in a class and a teacher is reading corduroy, and the child's mind kind of jumps and says, oh, I had a teddy bear, and I no longer have that teddy bear, and I miss it. Then what's just happened is that the child is being reminded of that loss. Now, our minds are very associational, and it's possible that the child might think, oh, I don't have my bear because my bear got hurt by a fire. And then you might sort of if you understood that, you might see, oh, actually now the book is a reminder of the danger of the trauma. And then we sometimes see dysregulated behavior. And so I just wanted to show you how things can be interconnected in some ways. And that when kind of they're in the presence of this reminder, they may behave in some ways that we might find challenging. And that one of the things that can be confusing for us is that different children may have different different stress response patterns. So I wrote this book called Once I Was Very, Very Scared. There's a free PDF on the website, Piplo Productions, that you can download. But I wrote it because I used animals to show kind of ways that we might respond in after danger. So for example, you can see that we might have actually opposing patterns. So that, for example, a turtle might slow down, withdraw, and a rabbit might move around a lot. And so you can look at this story and download it as a resource if that helps you to understand common reactions to stress, as well as common patterns of healing. Now, as we think about our plan of how can we help you, there are lots of things that help. We can support regulation by sleeping well, eating well, having good routines. We can move our bodies, understanding that when we are in danger and under stress, our bodies produce stress hormones that are designed to make us move, adrenaline and cortisol. So movement is really key to health and to recovery. And we can help children be able to name their feelings and talk about them and understand that we can have these feelings, but that we don't have to stay stuck in them, right? That we can feel sad, that we can be upset, that we could be scared, and that then we can get hugs and not stay stuck. And we can do things together with other community members as well, that we haven't lost everything. And that if we are fighting, if we are having more conflict, we can think about how, sometimes when we're stressed, we get mad at each other. But like, what are some of the things that we can do so that we can, have more protected time as grown-ups? We can turn off the news, we can make a plan to reduce conflict, and we can get help and support. So partially why I drew the triangle and really thought about reminders is that the first step to recovering from trauma is often really just being able to make the connection between experience and functioning, so that we're acknowledging this, so that we're not just seeing you as bad and as misbehaving, but we're understanding in some way that you're scared and this is how you show up. And when we understand that, we can help children also understand, oh, I wonder if this is because. And as that happens, the nervous system can calm down and children know that they're not alone. And another thing that we can do is to help them share their stories, because we don't want them to be alone with their stories and their feelings. And I don't know if this visual will be helpful, but this is one that I often use when I'm training, where this monster is just meant to be a representation of danger. Now, we wish we could banish the danger and erase it, but unfortunately, we can't do that. Now, sometimes when we try to protect children, we try not to talk about it, but if they do have a story and fears inside, and we're not giving them the space, then it's sort of like having fear without connection and protection, where what we can do instead is to really let them know that we, the grown-ups, this is supposed to be a symbol of protection, that we're there and that we're keeping you safe from the danger, and that if you do have fears and worries, that you're not alone with them, that you can come to us and you can talk about it. So I hope that this is helpful to you. I know it's brief, and thank you for all you're doing to help children and families.
With important things to Dr. Ghosh Ippen. I want to also say two quick things to our listeners. Number one is that all the resources that are being presented here, including what's being posted in chat, will be put on our website folks to be able to go and draw on, along with the recordings and the translations of the sessions. And the one request I do have is for the audience, if you could please put your questions in the Q&A versus the chat, that would be very helpful. So that way everybody can see what's answered. And we will also be saving the Q&A, not the chat, to create another document as a reference for participants. Okay, so with that, we are going to turn to a brief overview by Wendelin Slusser, who is our Associate Vice Provost for the Semel Healthy Campus Initiative Center at UCLA and the Clinical Professor of Pediatrics in the UCLA School of Medicine and Public Health, and the co-founder and academic director of the UCLA Fit for Healthy Weight program. Dr. Slusser has been a leader in community, school, clinic, and family-based programs that are focused on enhancing the physical, social, and emotional well-being of infants, children, young adults, and caregivers. We thought her particular perspective on addressing recovery through strong leadership and communication, particularly with UCLA and the other schools in the area being at the intersection of the LA wildfires, would be particularly critical. So thank you.
Thank you, Dr. Jackson and Dr. Teherani, for including me in this seminar. Today, I will briefly cover what you can do as a leader and as a healthcare provider to keep children safe during and after wildfires. As a leader during a crisis, one has to continue regular daily business, make plans, and sometimes update systems and policies in real time. Today, I will focus on how critical it is to have timely, informative, transparent, and compassionate communications. Communications is really the key ingredient to a successful disaster response. Let me give you an example of how we've been communicating at UCLA during this fire disaster. Chancellor Frank, who's a physician and a public health practitioner, has not only been regularly posting written messages from day one, but he's added a short video address that is amplified through all of the major social media platforms. The video address has brought a human touch to the messages, and there have been overwhelmingly positive responses to them, with thousands following the social media channels. The video addresses often follow the following themes. First, there's an update of the ongoing situation that day, such as about the actual fire or university operations, like remote versus in-person class instruction. There's acknowledgement of the current feelings, such as in the early days of the fire, the fear of the unknown. And then there's a form of providing hope by recognizing what is happening on the ground, such as acts of kindness that can lift spirits up and make things easier. UCLA Community Program Office, Semel HCI Center, and the Food Forward nonprofit, for instance, provided fresh food giveaways weekly ever since the fire started, serving up to 500 people per event. And then there's suggestions such as tapping into the reservoir of kindness, or the importance of keeping connected and getting through together. And lastly, the messages often end with a summary of information about how to stay safe or next steps in day-to-day operations. Another form of effective communications that we've rolled out are town halls. These meetings have been held with each core constituent: students, staff and faculty, parents, alumni, and university-wide one led by the chancellor. All of these forms of communications can be employed by leaders of organizations of all sorts and sizes, like faith-based organizations, schools, healthcare clinics, and after-school programs. And of note, organizations will be one of the backbones for recovering from crisis of this magnitude that we've experienced here in Los Angeles. Now, for one-on-one communications in your healthcare practice or in other scenarios during the disaster, I highly recommend psychological first aid training, which is an evidence-informed modular approach to help children, adolescents, adults, and families in the immediate aftermath of disaster. And you can get the asynchronous free online training at the Learning Center of the National Child Traumatic Stress Network. And there should be something in the chat that can give you the link. And so I would like to end by sending my gratitude to all of you who are attending this seminar and might be either responding to the fire disaster or preparing for one. And please be sure not to forget to take care of yourself. Thank you again, and please take care.
Thanks to Dr. Slusser. And with that, I'm going to turn it over to Dr. Dick Jackson, who is Professor Emeritus at the UCLA Fielding School of Public Health, and he was Department Chair in Environmental Health Sciences. He now teaches extensively at UC Berkeley Schools of Public Health, and as a pediatrician, he has served in many leadership positions with the California Health Department, including as the State Public Health Officer. For 9 years, he was director of the CDC's National Center for Environmental Health and received the Presidential Distinguished Service Award. He's an elected member of the National Academy of Medicine. Thank you, Dr. Jackson.
Thank you, Arianne. And I just love what Wendy had to say. And it's often can be easy to be breezy about people in leadership, but during these events, the leaders have to step up. I'm going to make a couple of big points that my career has been in environmental health, and every reform took a crisis to be put in place. The American approach to pandemics has been one of either neglect or panic. And I've often said that politicians can only have two gestures. One is to either point with pride or view with alarm. And we have to have an event that gets them to make the changes that we need to do to put in place. And I'll talk about how children have been very often the linchpin for that to go forward. And people that care for children have been the leaders for these reforms. I will also suggest that the test lab for environmental health progress has very, very often been California. And the current crisis that we're in, California, the world is going to be looking at California and our children, our pediatric advocacy as we go forward. And we've had in pediatrics a history of success as we've dealt with pesticides, air pollution, lead poisoning. And I'll tell you a few brief stories. In July of 1955, I was a little kid and I was watching on TV, the opening of Disneyland in way off California in Anaheim. And in the video, if you can see in the background, you see the I-5 freeway, and it has almost no traffic on it. You can't remember a day like that, right? And California's population was then 13 million. We now have 3 times as many. Just 2 months later, California, Los Angeles experienced the worst smog day in its history. Eyes and lungs burned, people stayed indoors, sporting events were canceled, schools closed, citrus groves withered. The ever-increasing smog in the Los Angeles basin was a crisis. This crisis led to 70 years of hard work by the South Coast Air Quality Management District and the state of California. And it didn't all happen at once. They had to ratchet down open burning of garbage and changing emissions from cars. And yet during that time, the focus on children's health had a major role. 100 years ago, the gasoline industry began to add tetraethyl lead to gasoline, 3 grams of it for every gallon of gasoline. And that went on for the next 80 years. You can imagine millions of pounds of lead being atomized and spewed out the tailpipes of cars all across our environment. And for example, children that lived on the lower floors of apartment buildings had considerably higher blood lead levels than persons who lived higher up. And people, for example, who worked as toll collectors on bridges and tunnels had much higher levels than other people. Of course, lead was in our paint, it was in our food, it was in many other sources. But by the late 1960s, big cities were reporting 10 or more children dying from lead poisoning every year. And the definition of lead poisoning was a blood lead over 60 micrograms per liter, deciliter, but 60. And during that whole time, health advocates were becoming more and more effective in calling for the reduction of all sources of lead, and children were very much the center point in that effort. Over time, the South Coast Air District worked with the Jet Propulsion Laboratory and developed the catalytic converter, which reduced tailpipe emissions, reduced the nitrous oxide, reduced the smog that was being produced. But you can't have a catalytic converter if you can't use it if you have leaded gasoline, because it fouls those very expensive precious metals that are in the catalytic converter. And so by the 1990s, California had phased out leaded gasoline. The rest of the country thought there was something wrong with us, but within a few years, the entire country phased it out. And I'll tell you how we got other countries to phase it out. Getting rid of lead and water in our homes has been remarkable in terms of not only improving our health, but actually the brain function. Every 10 points of blood lead is about 2 IQ points. So mine was 26 back when I was a kid, that meant I lost about 5 IQ points. Today, the trigger for an investigation of lead exposure is 3.5, down from 60. And so when I was at CDC, we presented the human data, to the states and to politicians, but I also had the chance to present it in Russia with Vice President Gore as they were becoming more industrialized, and we also did it for the Minister of Health in China, and that led to both those countries banning leaded gasoline. That was based on children. Child health leaders were also essential in pesticide reforms. In the late 20th century, we think of all the environmental laws, but they were back in about 1970. The next 25 years, there were no environmental health laws passed until the Food Quality Protection Act. And it grew out of a scandal that there was too little and sometimes fraudulent health effect testing of pesticides, particularly for cancer-causing and developmental effects. Back then, the allowable limits for pesticides on foods, called tolerances, were calculated based on the diets of, not those children that Amy was talking about, of grown men, probably sitting on a couch, and rather than that of a growing child who consumes much more food per kilogram of body weight. Moreover, the testing of residues in food, you won't believe this. They would take 100 pounds of apples, they'd turn it into a slurry, basically applesauce, take a dollop out, and then measure how much malathion or some other chemical was in those 100 pounds. Well, children don't eat 100 pounds at a time. They eat one apple or baked potato or whatever at a time. And yet the amounts sometimes were very high on some apples and very low on others. So the law was passed to really ratchet down those tolerances, change how we sample, really measure what was going into people, measure what was in people, and that led to the Food Quality Protection Act. And a big change happened in the under the around 1980 was the cancer cluster in the Central Valley of towns of McFarland and Rosamond. And when I was with the health department, we pulled together a high-level advisory committee, and they recommended, how do you figure out what a child was exposed to 10 years before? You can't. So they recommended clinics, but they also recommended full reporting of all pesticide use in California. And shockingly, we got that through the legislature. And the only state that keeps track of this, and this has been priceless to researchers in Salinas, at UCSF, Berkeley, and at UCLA, looking at later life diseases, including Parkinson's and others, that data on what's there. By the way, no other state has a pesticide use recording, which is a scandal. So the fires are now the new normal in America. And by the way, I just read the other day that 30% perhaps increase in the intensity and the likelihood of the past fires was probably related to climate heating. And throughout history, the poorest and most vulnerable are the ones that suffer the most. Climate heating is a trigger for famine. It's a major driver of migrations, and the United States government National Intelligence Assessment said that climate change is politically destabilizing and what they call a threat multiplier. The amount of heat trapping CO2 in the atmosphere since I was in school back watching Disneyland open. It was back then it was 300 parts per million. It's now 435 parts per million. The increase is 100 times faster than previous natural increases. And it means there's a lot more heat energy and moisture in the atmosphere. My 10-year-old granddaughter has now lived through the hottest years in recorded history. And about 90% of all that heat goes into the ocean, and about 30% of all the CO2 goes in the oceans. And that changes both the temperature of the oceans and the acidity, and it affects various other species. And these hot waters, if you will, warmer waters, put more energy and moisture into the atmosphere, means more violent storms, more intense rainfalls, hotter heat waves, longer droughts, and fires. So here's my takeaway. In public health, we often assert that a good solution solves multiple problems. And we Americans are very good at taking one narrow problem and coming up with one narrow solution. And maybe in the era of AI or something else, we can figure out how we can come up with solutions that solve across many of our challenges. So in the case of rebuilding, we need urban plans that enable ready escape. And you look at the places where people had to escape, there are endless cul-de-sacs, dead ends, with only one exit road. That led to a number of deaths in Paradise, California. We need fire-resistant buildings, fire-resistant landscapes, advanced communication amongst emergency responders and others, and tools, satellite and otherwise, for detecting fire sources. This seems obvious, but we need uphill reservoirs so that we don't run out of water if you have to depend on electrical power, which is what happened in Oakland, California 20 years ago, 30 years ago. We need undergrounded utilities and more. And all the while, as we do this, we've got to reduce our own greenhouse gas harm to our planet. We have to come up with solutions that can focus on the tremendous burden our children are being forced to confront. Thank you for your attention. Thank you for
Thank you, Dr. Jackson. Well, thank you, everyone, for the wonderful and very insightful talks. For the audience, I think we have gotten through answering as many questions as we can. We will be saving the rest of the questions and responding to those and putting them on our website. So stay tuned for that. It'll take a few days. Having said that, I really want to extend my thank you to all of our speakers. This was a very helpful and insightful series of talks, and I hope it's been helpful to our communities throughout California, in Los Angeles, and in our UC community. A reminder that our talk next week will focus on psychological first aid and communal support for acute stress, moderated by Dr. Alyssa Eppel. And we look forward to seeing all of you then. Thank you.